Hi, good morning. My name is Joe Covell. I'm with CustomBenefitPlans.com. We're in the middle of open enrollment for Medicare Advantage and also Part D prescription plans. So we wanted to do this little presentation as we're currently going through overhauling our website and improving our branding a bit. So this is intended for consumers, those that are Medicare age already on Medicare or maybe looking to retire, leave work coverage, or those that will be 65 in the near future, will be on Medicare soon. It's also for our agents or those that are, interested in becoming one of our agents too. This presentation is available to use, and this slide deck we can send to you too if you're one of our agents or interested in being one of our agents. So, want to thank you all for joining us. Hopefully, everybody's staying safe during these crazy times, and don't forget to vote. So, we're going to get right into the presentation here in a moment. All right. So again, Joe Covell Custom Benefit Plans. We're located in Willow Grove, Pennsylvania, and we service all forms of health insurance, individual, those under 65 on Affordable Care Act or Obamacare. Those are looking for alternatives, the various Medicare products, Medicare supplements, Medicare Advantage, and Medicare Part D prescription, and also group insurance, life insurance, disability, annuities. There's really no form of insurance that we don't handle. So again, thanks for joining us. So this again is an introductory course on the different parts of Medicare. It's not going to be very long, maybe 16 slides or so. So again, the basics of Medicare. So Medicare is a federal program that provides health insurance to anyone who meets the following three conditions. That would be those that are 65 or older, people who are under 65 with certain disabilities. You have to be on Medicare disability to be able to get Medicare if you're under 65. And then those that have end-stage renal disease of any age, that would be permanent kidney failure requiring dialysis or even a kidney transplant. There are four parts to Medicare. We have what's original Medicare, which is Part A and B. A would be your hospital coverage and B would be your medical care. And then we have Part C and D, which are more the private elements of Medicare. Part C would be Medicare Advantage plans and Part D would be prescription drug coverage. So what does original Medicare cover? Part A of Medicare is your hospital care, your skilled nursing facility care, your nursing home care, hospice, and home health services. Part B, this is the part that most pay for. That covers doctors and other provider services, ambulance services, durable medical equipment, mental health, and limited outpatient prescription drugs. Part A is the premium free part for most taxpayers. What that means is those that worked 40 quarters or 10 years, paid enough taxes, you get this for free in most cases. If you paid Medicare taxes for less than 30 quarters, the standard Part A premium is $458. And if you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $252. Medicare Part B, again, that's your medical care. This has a monthly premium for most people. Most people will pay $144.60 in 2020, and we're still waiting for the updates for 2021. As of today, which is October 31st, they're still waiting to have that announced from CMS, which is the Centers for Medicare and Medicaid Services. So as a result of the income-related monthly adjustment amount, we'll get into that more, there can be surcharges that apply. So basically what this means is based on your income, you may pay more or you may pay less for your Part B. So we're going to go into that in the next couple screens here. And we're going to go into it right now. So basically, if you make less than $87,000 and you're a single, or for a couple under $174,000, your Part B premium is $144.60. And then you can see there are tiers. So if you're a single making above $500,000 a year or a couple over $750,000, your Part B premium is $491.60. And to clarify that, if you're a couple over that income, that's a piece. So that's $491.60 per each husband and wife for a married couple if you're both on Medicare. And the other two parts of Medicare, again, are the private elements. This time of year, you love to see well, you can't turn on the TV and not see pictures of the red, white, and blue Medicare card advertising extra benefits. We're right here in the heart of Medicare Advantage season. So you can't turn on the TV right now and not see those ads. So those $0 ads you see, or what you see Joe Namath or Joan London promoting a lot these days, would be those Medicare Advantage plans which don't have a monthly cost to them, right? They're zero premium. And then also Part D prescription plans. Part D prescription plans can either be a standalone PDP, what we call prescription drug plan, PDP, or it can be part of the Medicare Advantage plan. Most times it usually is part of the Medicare Advantage plan. If you're going to pick up a Medicare Advantage plan, there's really only limited options for Medicare Advantage plans that only have the Medicare Advantage without the prescription. We usually call these MA only, Medicare Advantage MA. MAPD would be Medicare Advantage prescription drugs. So those are common acronyms that you'll see agents and consumers. So more about Part C. This is a government-sponsored option to receive benefits of Medicare A and B through a private health plan. So those zero premiums, they're through a health plan, right? Blue Cross. Right here, we're in Independence Blue Cross right here because I'm calling you, doing this from the Philadelphia 5-county area. Aetna, Humana, Cigna, AARP, which is United Healthcare. Those are all private insurance plans. So original Medicare Part A and B is more of a federal program, and then Medicare supplements, Medicare Advantage plans, and Medicare Part D are all private insurance. So Medicare Advantage plans, they help you to pay your out-of-pocket costs under A and B. So what's going on with the Medicare Advantage plan is you're essentially replacing A and B with the Medicare Advantage plan, which is going to cover A, B, the holes of that, as well as the prescription drugs. So this is something that's similar more to something you might get if you're under 65 through healthcare.gov, or in Pennsylvania, tomorrow is going to start penny.com, and Jersey's going to have getcovered.nj.gov, or something you had through work. So that's, where you're going to have a network, either an HMO or PPO, or a hybrid of the two, and you're going to have co-pays for all your services. So that's more what the Medicare Advantage plan is like. So, and you can see the different parts. You have your $1,400 deductible Part A, your average 170.50 per day for skilled nursing facility for days 21 through 100, $185 Part B deductible, 20% coinsurance for covered doctor services. So these are typically where the Advantage plan is coming in and picking up a lot of these different elements. Now continued. Many plans, MAPDs, provide Part D prescription coverage, often include additional benefits. So this is where our friend Joe Namath comes in and has that ad running all the time. Are you getting the most out of Medicare? Or now with the COVID-19 pandemic, I think the new one is because of the virus, make sure you're getting the most benefits. What they're referring here are what I like to call bells and whistles, right? The vision, the hearing, wellness services, dental coverage, and over-the-counter allowances. So what's an over-the-counter allowance? So you get drugs from a pharmacy, your prescriptions, that wouldn't be over the counter. The things that are in the store for the most part, in the CVS, in the Walgreens, Advil, Tylenol, there's a long list. So with a lot of these companies, when this first started a couple of years ago, there was a catalog and you had to do mostly online or mail order. A lot of the plans lately, especially here in the Philadelphia area, are allowing for a card in which you can go into certain retail facilities and use that same allowance. So that allowance can be anywhere from $20 or $30 a quarter to $60 a quarter. If you have Medicare and Medicaid through the state, it can be as high as $120 a quarter. Some do it per month, $20, $30 a month. So it really depends on the plan, on the carriers, with the over-the-counter allowance. The same with the dental. I mean, dental coverage can be anything from 250 a $250 allowance up to 2,000 up to $3,000 allowance, depending again on the carrier. But you also have to, usually there's some caveats to that. Like you have to go to specific dentists or you have to use a specific network. So, there are some nuances to those benefits, but they're getting a lot of attention. Also, gym memberships, Silver Sneakers, Silver and Fit, those type of programs are in most Medicare Advantage plans that you'll find on the market. And again, with a Medicare Advantage plan, you often have a zero premium or a low monthly premium. Some can get up, in essence, as close to $300 a month, with better benefits. So the plans that have more of a monthly premium tend to come with a little bit expanded benefits. The zero premiums might have hospital copays for inpatient of about $200 to $250 to $300 per day. Some of the plans out there where you pay maybe $30, $40, $50, $60 a month, instead of having the per day copay, you'll see where you have a per stay copay. So that could be good or bad. If you have a $400 per stay copay, that means if you're in there for a day, you pay $400, but if you're in there for 5 days, you pay $400. So if you're in there for less than 3 days or so, usually this works out for you. If you're worried about the plans where you have to pay $250 a day for 5 to 7 days, and that could be a good compromise and a good middle ground between an Advantage plan and a supplement. And again, we'll go into supplements in a little bit. In order to be in a Medicare Advantage plan, Part C, you have to have Part A and Part B. And like I said, again, there'll be defined networks. So you have HMOs or PPOs. So an HMO would normally require you to have a referral, although that's kind of started to go away. Most of these plans don't have referrals, but you still have a network. So on an HMO, you have to be inside that network unless it's an emergency. With a PPO or preferred provider organization, you can use the network and you'll benefit from the services of the network. There'll be lower costs versus out of network. Typically without a network, you might pay 20 to 30% and maybe even have a deductible up to $10,000, again, depending on the plan. So there's a lot of different nuances to that. And then you might also have what's called an HMO POS, point of service, where it kind of acts like it basically acts like an HMO, but you also get out of network benefits too. Not as robust as a PPO. And you also have other different plans like cost share, MSA plans, which is a form of an HSA. We deal with some companies like that too. So, if you have any questions on the different networks or the different plans, that's what we're here for. Again, whether you're an agent or whether you're a consumer, we're able to help every single person. So Part D prescription drug plans. So these must be purchased in addition to Medicare A and B with some nuances. Basically, you have to have some form of credible drug coverage or you will incur late enrollment penalties when you do decide, or if you do decide to pick up something that has a prescription plan in it. So if you turn 65 and you don't have any prescription drug coverage, you wait till age 75, you're going to incur a late enrollment penalty for every month that you do not have prescription drug coverage. So if it's been a year or two, it's usually not a lot. But if it's been 10 years, I mean, you could be looking at adding $40 to $50 onto your monthly premium. So like that $0 plan, once you submit that application and it comes back that it's $50, what's going on there is the government's telling the plan that the prospect hasn't had, or I'm sorry, the beneficiary hasn't had coverage for 10 years, whatever it may be. And there's a formula that you can look up online. Usually you take the average cost of a prescription drug plan in America, say it's about $34. You multiply that by the number of months that there was no insurance, and then you usually multiply that by 1%, and that gives you your monthly fine, your fine that you're going to pay every month. And this follows you the rest of your life. It really will only ever disappear if you fall into a low income bracket, in which case then that gets picked up in most cases. But so it's definitely not something you want to have to deal with. It's always better just to buy a $7 or $14 prescription drug plan just to not have this problem later on. And these plans are offered through private Medicare approved insurance plans. The monthly premiums vary. The projected average for 2020 is around $30. But again, they can be as low as 8, 9, 10, $12. It all depends on your usage, and where you go to use it. High income enrollees may even pay a higher price. Just like for Part B, they'll also pay it for Part D. This is as a result of the income-related monthly adjustable amount again. That's the same surcharge chart we showed before, but it's a little different for Part D. And here it is for that. So I showed you this chart before for the premium that you could pay for Part B. Here's the premium you could pay for Part D based on your income. So most people that are under 87,000 or a couple, a joint tax return under 174,000, you're basically just going to pay your plan premium. But if you make over 500,000 for an individual or 750,000 for a couple, you can expect to tack on $76.40 to whatever plan you buy. So if it's a $30 premium, you add that onto it. So you're looking, in the 90 range there in that case, or $100, sorry. So yeah, so you not only get surcharged for Part B, you also get surcharged for Part D. And when they're asking about this income bracket, it's usually the last couple years or so filing. So this can be reassessed. Say you own a business and you're over 500,000, and then you go more to a fixed income retirement and you're nowhere near that. I mean, they do reassess that. So you can go back to Medicare and have them look at that to see if you can get that lowered. So that's, unlike the late enrollment penalty that just tends to follow you, this can be reassessed. All right, so the Part D coverage levels. So whether you have a standalone prescription plan or you have prescription through a Medicare Advantage plan, these are basically the 4 standard phases of prescription coverage on Medicare. So phase 4, you have any deductible that you might have. After you met your deductible, you're in your initial coverage phase where basically everything's going to be a copay. And also I want to add, with the deductible phase, a lot of plans do not count Tier 1 and Tier 2 generics, the low-cost generics, in that deductible. So if a standard deductible for this year coming is $445, most of your maintenance drugs on most plans are going to be in Tier 1 and Tier 2, and you're just going to have a low copay. You're not going to have to meet that deductible. But for Tier 3, 4, 5, which would be your brands and your specialties, those are most likely going to meet the deductible. After you meet that deductible, you're in your initial coverage phase until till there's a combined reach of $4,130. So once this is met, then you enter what's called the donut hole that everybody has heard of and dreads. So yes, the donut hole still exists today, but with the donut hole, it's come down a lot, where basically the cost share is only 25% for most. That's generics and brand, whereas in the past it was a lot more. So the donut hole is still there, and it still affects a lot of people, but the cost share percentages are just not as extreme as they once were. So you're in this donut hole phase or coverage gap phase from $4,130 up to $6,550. Once you reach that, now you're in your catastrophic phase, phase 4. So here you will pay the greater of 5% or $3.70 for generics and $9.20 for brand name drugs. So once you reach that, if you reach that, and we hope you never do in the course of the year, but a lot do, if you do reach that, then you go to the catastrophic phase where you have low copays again. All right. Last but not least, going to talk about our friends Medigap Plans. Medigap, also known as Medicare Supplements. These are sold by private companies. These fill the gaps of original Medicare. So, for example, Medicare Part B generally pays 80% of the bill, right? Medigap Plans help cover that your portion. So if you're on just original Medicare with A and B, they're paying about the federal government's paying about 80%. You are picking up the remaining 20%. And if you don't have a Medigap or a Medicare Advantage plan, which a lot of people do just have original Medicare, you can expect to pay 20% of the bill with no cap. So at least with a Medicare Advantage plan, there tends to be a maximum out of pocket. Just about every one does. I can't think of one that doesn't. So that right then and there is an advantage to original Medicare with an Advantage plan is that you actually have a set cap. So, whether you're a fan of Advantage plans or not, and, it's not a one size fits all for everybody, they do have their place and they are better for some than just having straight original Medicare and nothing else. Medicare Advantage plans are always guaranteed. So every year in the fall, from October 15th to December 7th, you can either change your Medicare Advantage plan or pick one up if you didn't have one before or if you were in a supplement plan. So those are always guaranteed regardless of age. Supplements are not guaranteed. Medigap plans are standardized. All policies offer the same basic benefits, but some offer additional benefits. For example, a few on the market in our area offer the gym membership, silver sneakers, but they're few and far between. But some do a little bit extra, offer discount type services. But these do not cover Part D, and they haven't for some time. These are a great option for people who are currently receiving or seeking ongoing medical treatment. So the attractiveness of the supplement are a few different things. One, it's hard to just buy any time. You have your first 6 months. So let's just say you turn 65, you have your birth month and 6 months after in which you can buy one of these plans without any health questions asked. Same if you're leaving employer coverage or your plan leaves the area or you move to a market where your old plan was not, or you move to a market where there's a bunch of different nuances we're not going to get into. But those are called guaranteed issue periods. So guaranteed issue periods are when you're first eligible or part ways with an employer, no health questions asked. After that, they ask health questions. It's same if you want to change, even if you want to downgrade. If you start in one plan and want to go from, say, a plan F to a plan N, that does require medical underwriting, health questions to be asked. So these plans aren't easy to pick up and they're not easy to change. So it's good to go with a company that has a good reputation that's going to keep the price level year after year if this is the plan of your choice. These are attractive because typically you really only have your monthly premium every month, so you can kind of set your costs, right? Every year I know that if I pay say I pay $1,800 a year for my supplement, I know that that's my cost, and outside of we can't count prescription in that, but we can set the fact that my medical care will not cost more than my premiums for that year. Whereas with an Advantage plan, again, they can nickel and dime you. Everything has a copay, so that can add up pretty quick. So people tend to like supplements because of the predictability and also the freedom. With a Medigap plan, you can go anywhere in the country that takes Medicare. And if they take Medicare, they take your supplement. It's not like with an Advantage or typical other type of insurance where you have to, you have to ask the doctor if they accept a network. On a Medigap or Medicare Advantage plan, if the doctor accepts Medicare, they usually, most times, there's rare cases that I've seen it not happen, they're going to take your supplement. And the supplement's going to basically do whatever Medicare does. So if Medicare covers the service or the procedure, then the supplement will cover whatever Medicare doesn't. If I go to a doctor that doesn't accept Medicare, then most likely not much is going to help me here, and I'm going to end up paying out of pocket to that doctor. A doctor who doesn't take Medicare typically won't take a Medicare Advantage plan just because they find it a little easier to bill the federal government Medicare than they do a private insurance company who's going to dot every I and cross every T's. So there's a lot going on there. So again, I want to thank you for attending this. We are here to help you. This is our phone number, 866-422-9188. I'm at extension 208. CustomBenefitPlans.com is our website. We're going through some transitioning. We're going to be updating that very soon. So you're going to see a lot of really cool, exciting changes here. But again, we're here to help you. And okay, sorry about that. Gotta love technology. So again, I want to thank you for watching this. If you have any questions, you can send us a direct message. You can shoot me an email. My email is jcovell, JCOVELL at custombenefitplans.com. If you have any questions, either as a consumer or as an agent, or you're looking to add a company, you're looking to get into selling Medicare, whatever it may be, I do both. I help advise people and I help advise agents. My main role is to advise agents. So I'm here to help you. If you have any questions, please give me a call, shoot me an email, or you can stop into, we're at 616 Easton Road in Willow Grove, Pennsylvania. That's right across from the Willow Grove Post Office at the corner of Easton and Dallas. We are completely COVID compliant. We have plexiglass, we have masks, sanitize everything multiple times a day. But we can also have one of our agents or myself do consultations via Zoom like this or over the phone. So whatever we can do to accommodate, we want you to be comfortable, both our agents and also consumers out there that are looking for help. So again, thank you so much. Enjoy the rest of your weekend. And for agents who deal with both markets, individual health starts tomorrow, so get some sleep. You're going to need that extra hour sleep. Thanks so much. I appreciate your time.